Social anxiety disorder is one of the most common forms of anxiety disorder. It's also one of the hardest to treat. There are different treatments for social anxiety disorder. Some people find that cognitive behavioral therapy works well. Others prefer medications like antidepressants or anti-anxiety drugs. Your doctor may recommend a combination of these approaches. Social anxiety treatment includes cognitive behavioral therapy, CBT, and exposure therapy. CBT teaches you to challenge irrational beliefs and thought processes that lead to excessive fear. Exposure therapy involves gradually confronting feared stimuli to desensitize you to them. Both treatments can effectively treat social anxiety disorder. The first step towards recovery from a social anxiety disorder is recognizing that you have this condition. This means learning to identify the symptoms of social anxiety disorder and what causes them. Once you know what causes your symptoms, you can begin to change those things. Changing those factors will help reduce your symptoms. Using self-help methods such as relaxation techniques, journaling, and exercise can help with reducing your symptoms. The best ways to overcome social anxiety include 1. Learning relaxation techniques such as deep breathing exercises. Relaxation training helps reduce the physical tension associated with anxiety. 2. Learning to control negative thoughts. Negative thinking patterns often contribute to anxiety. By changing your thoughts, you can learn to think positively. 3. Avoid situations where you may experience anxiety. For example, if you feel anxious in large groups, avoid going to parties or meeting new people. If you feel anxious when speaking in front of others, practice public speaking skills until you no longer feel nervous. 4. Finding support. Talking about your feelings with friends and family members who understand will help you cope better. You might want to join an online forum or chat room where you can talk with others who have similar problems. 5. Developing skills to cope with stressful situations. When you encounter a situation that triggers anxiety, try to recognize it early on to prepare yourself before it happens. Practice coping strategies such as deep breathing, talking to someone else, taking a break, and distracting yourself. 6. Finding activities that make you happy. Try to do something enjoyable every day. Hobbies and interests can be excellent sources of pleasure. They can also provide you with a sense of accomplishment and self-esteem. 7. Taking medication. Antidepressants and anti-anxiety medications can help relieve some of the symptoms of social anxiety. However, they should never be used to replace proper treatment. Talk to your doctor about which type of treatment would work best for you. 8. Seeking professional counseling or psychotherapy. A therapist trained in treating anxiety disorders can teach you how to manage your fears and develop coping mechanisms. In addition to seeking treatment, you should be vigilant about avoiding situations that trigger anxiety. Try not to worry too much about what other people think of you. Instead, focus on doing what makes you happy. If you suffer from a social anxiety disorder, it's important to remember that you're not alone. Many people struggle with this problem just like you. The good news is that treatment options exist. Social anxiety is not an incurable problem. Knowing what causes social anxiety disorder makes you one step ahead in identifying how to deal with it. If you enjoy watching this video, please support my channel by clicking on the like and subscribe button. Also, please consider watching my other videos to learn more about how you can improve yourself each day.